Good morning, everyone, and welcome to the Master of Osteopathy delivered by Malta ICOM Educational in partnership with the College Sutherland in Germany. So the purpose of this presentation is to introduce you to the program and to the institution itself. So who are we? Malta ICOM Educational is a higher education institution accredited by the Malta Further and Higher Education Authority, which is the Ministry of Education in Malta. Apart from osteopathy, where we have a Bachelor of Science 4-year full-time in osteopathy, a Master of Osteopathy, this 18-month program, we also have a Bachelor program in Physiotherapy, which is a 4-year full-time program, and a Bachelor of Psychology and a Bachelor of Dental Hygiene. So as an institution, we moved away from simply being based around osteopathy, where the institution started approximately 16, 17 years ago in Italy as the International College of Osteopathic Medicine, an institution in Italy delivering a 5-year diploma in osteopathy program, which then was validated also as a bachelor degree and later as a master's degree in collaboration with UK universities. So we moved away from being just a monotechnic institution focused around osteopathy to deliver other programs within the field of healthcare. And then we, in 2018, we moved to Malta, where we became a higher education institution. So important thing to, and this is a little bit of where we are in Malta. So we have 2 campuses in Malta, in Zira and Santa Venera, and where we deliver all the teaching. And then we have a number of clinical placements in Italy for all our Italian students, and in France for our physiotherapy students. And of course, we also work in partnership with Sutherland College in Germany to deliver the master's program in partnership with them, and with part of the teaching and the clinical training taking place in Germany. So a few important points to kind of highlight this difference between a higher education institution and the university and what it means to be accredited. So when we talk about the programs are accredited, it means they have been assessed by the Malta Further and Higher Education Institution, and they are pegged on the Malta Qualification Framework, which is exactly the same framework as happened in other European Union countries. Since the Bologna process in 2005, as we know, the European Union unified and standardized the qualification framework across the whole Europe. So the Malta qualification framework is exactly the same framework as in other European Union countries. So that means the entry point into higher education is level 4-5. The first point of qualification at bachelor's degree is a level 7. A master's is a level is a level 6. A master's is a level 7 qualification, which is this program, and then level 8 is reserved to doctoral programs. I mentioned the important points to distinguish here between being a university and a higher education institution. So the MFHEA only considers accredited higher education institutions to be eligible for university status if they fulfill, of course, the criteria described in the law, and that means a dimension as an institution, the capacity within the institution to deliver all programs from level 6, 7, and 8, therefore doctoral programs, whereas the higher education institutions, which are what we have as a license for the Malta for the Malta ICOM Educational, is a license that is granted to the providers to deliver programs up to level 7. So we are only allowed to deliver programs up to master's level because we are not a university. However, we are a higher education institution with the same degree awarding powers. So after the programs have been accredited by the authority, we are we are allowed to deliver the programs within the prescribed rules and regulations. In a sense, if we try to make some analogy to some countries in Europe, particularly in Germany, where there are universities and Fachhochschulen, so kind of universities of applied science, technical universities, so slightly smaller institutions. And in a sense, that's the kind of the difference here between the university and the higher education institution. So let's go down to talk a little bit about the master's program. So it's an 18-month program delivering 90 ECTSs at level 7, so master's level, and the 90 ECTSs are the kind of the time the credits allocated to an 18-month program. So the program from the start to the end. So if in the case of the next cohort starting in November, the end point for that program is going to be May of 2026. And that's because one full-time year within the European Union is equivalent to 90 ECTSs, or 1,500 hours of student work. And of course, we have to respect that framework. There are 2 interim awards here for people that do not manage to complete the full program. So completion of 2 modules enables you to exit the program with a postgraduate certificate, and completion of 4 modules enable you to exit the program with a postgraduate diploma. The aims of the program. So it is a postgrad program. So it's not a kind of a pre-registration entry into the profession, but a program that is designed for people that are already in practice, people that started questioning their practice, want to advance their knowledge, want to advance their skills, their kind of competence profile, maybe want to go in particular specialisms. So that's the program for you. So if you want to kind of move a little bit ahead of other people that have just done the entry point into the profession, but actually want to be more confident, more effective with your patients, to start sort of questioning, some assumptions in osteopathy, start using a little bit more criticality. That's what the program kind of equips you with. So that level of critical appraisal, the ability to look at things, look at the profession, look at the kind of concepts, look from a critical perspective, and start having the capacity to also, look at the research, being confident, look at the research and extract the relevant type of information, rather than just consuming the research without, that critical eye. It also gives you an opportunity to explore advanced practice in a number of fields. For example, looking at person-centered concepts, you look at how we approach patients complaining of of persistent pain, of persistent physical symptoms, but also look also in depth in terms of osteopathy in the field of pediatrics and neonatology, and also osteopathy in the field of sports and the performing arts. So entry requirements, of course, as a master's degree, there's an expectation people have a bachelor degree qualification. It could be the case that some of you have a diploma in osteopathy and also are qualified physiotherapists, so that bachelor degree fulfills the requirement. But for those of you that don't have that bachelor degree and have have done your osteopathic training, have done a 4 or 5 year program of study, it does not mean that you cannot enter the program. What would be required is that you provide evidence that actually since you qualified during your training, but that actually since you qualified, you have qualified for at least 3 years, you have developed as individuals, you have kind of developed the necessary skills to enter a master's level program. So it's not the end of the world if people don't have the bachelor degree as an entry point, because we can explore how we can sort of fulfill those requirements through, for example, looking at a portfolio of evidence which is relevant to your clinical. So a brief overview of how it looks like for the first for this upcoming academic year. So the program that starts next month. So we have the first teaching block in Schlagenbad and starting on the 18th of November. And the teaching blocks take the form of 6 consecutive days with 1 day break and then another week of 6 consecutive days. So this way we can condense and put a lot of content together in a short period of time, sort of, enabling you to take time off from your clinical practice to attend the teaching, but not having to, come for teaching lessons, let's say, every other weekend and so on. So it's a condensed kind of intensive learning experience, and we will deliver the necessary material. We will enable you to sort of start getting involved in some critical discussions about, the context of the contents of the modules and so on. So first part starting, as I mentioned before, with advanced clinical reasoning and osteopathic care. And also we start in the first teaching block with advanced research methods and epidemiology and public health. And as you can see on the Tuesday there, we also get you to start working on your research ideas. And now, for the research project, one thing it's important to point out is that the projects can be done individually. So you can work on your own research project with your supervisor, or you can work in a group setting with another colleague or, 2 other colleagues. So groups up to 3 people. And the idea is, looking at research in the real world, which of course involves, working collaboratively, working in a group setting. So the idea is, people work together on developing their research question, their methodology for the study, and then that part is common for both the research proposal and then for the dissertation later on. And when then you go on and conduct your data collection, so conduct your study, the data collection is done together and the data analysis is done together. And the difference then is when you write your dissertation, the introduction is going to be an individual effort, and the discussion and conclusions are going to be individual as well. However, the methodology and the results are going to be common to the group. So this enables you to work together to kind of support each other and very much resembles what research is in the real world. Second teaching block taking place again in Schlagenbad in February of next year. And as you can see, the first week is entirely dedicated to pediatrics with both Francesco Cerritelli and Ruggero Tinelli, which are lecturers from Italy. Francesco, well known for quite a few people within the field of research in osteopathy. The second week on that teaching block is entirely dedicated to the research, public health epidemiology. And again, we'll continue working on the research questions, working towards your research proposal. And then we'll also be covering quite a lot of materials around methodology, statistical analysis, concepts of public health and epidemiology with my colleagues. The final teaching block takes place in Malta and takes place in May with Paul Bell, who's an osteopath with a PhD in the field of sports, and he will be working with you during the entirety of this teaching block for 2 weeks. So that's the teaching. Then in July, there's an exam of clinical competence, which is built within this program. And of course, you see, depends on the size of the group, we may need to extend to, more days, within that week. But the important thing is you will need to attend just 1 day, one morning or one afternoon, and this will involve you assessing and treating 1 new patient in assessment conditions. Here, there's a kind of a bit of a kind of an introduction to what the assessments look like. So each module has 2 points of assessment. The first module on the advanced clinical reasoning and osteopathic care has a case report from a case that you extract from your clinical practice and then do a reflection on that case and link to the literature, highlighting how you treated the patient, how you approach the whole osteopathic care. And then there's the final clinical competence assessment in July. The other modules on the research methods is both a research proposal that I explained can be done individually or as a group project with part of it, the methodology, and this is the first part of your dissertation. So you start working on your dissertation pretty much early on from the moment go. And then there's also a online written exam on research methods, public health, and epidemiology with multiple choice questions. The osteopathic sports care, the osteopathic pediatric care includes an online mini clinical exam, which is a case scenario that you will have to discuss your osteopathic approach to that case with a panel of 2 examiners that will be online with you. And that's, it's between 20 and 30 minutes assessment. And the second point of assessment is a reflective essay, around the field of pediatrics. Sports care is identical to pediatrics in terms of the structure, so the same kind of setting for the online clinical exam, of course, in the field of sports, and then again a 3,000-word essay around concepts related to sports. And the final part is the dissertation that is submitted towards the end. As you can see, in February of 2026, you submit your dissertation, which could be between 8,000 to 12,000 words, and then you present, a month afterwards, you present your work, so you defend your dissertation. Final thing to mention is about the teaching team. So the teaching team, important to be able to deliver a master's program, is all people with responsibilities for leading on lessons, for leading modules, need to have a PhD. Others you see without a PhD are assistants and are specialists within the team, but then don't have the responsibilities of actually leading the module. So myself and Andrea Borello, who's an Italian osteopath trained in the UK. I'm also an osteopath, have been practicing since 1993, worked in different countries, from Portugal, from where I'm from, 17 years in the UK, both in clinical practice and in academic management, working at Oxford Brookes University and then at the British School of Osteopathy as head of research. And I'm heavily involved in the field of research. And then I worked in Dubai and Saudi Arabia for 2 years each. And for the last 4 years, I've been working with Malta ICOM Education, where I'm the vice principal. The research methods, apart from myself, Nuno Esteves and Francesca Cavallo. Nuno is a physiologist with PhD in physiology, and Francesca is a data scientist working with the National Health Service in the UK, and she has a PhD from Imperial College in London. Osteopathic pediatrics with Francesco Cerritelli, an osteopath with a PhD in neuroscience, and Ruggero, an Italian osteopath specialized in the field of pediatrics, who trains, has got a master's from the UK. And finally, Paul Bell, a British osteopath that worked for 20 years in Singapore and did his PhD at University of Bath in the UK, and his study was based around biomechanical analysis and injury prevention in young footballers. And finally, for the dissertation, I'm in charge of, overseeing the process and supervising you, and I'm supported by Sonia Hartman, an osteopath that has worked for many years at Sutherland College in Germany, and Patrick van Duin, who's a Belgian osteopath that practices also in Germany, and several years ago was also a teacher at Sutherland College. And Patrick works with me also on the board of directors of COM Collaboration. Okay, so I hope that this gives you an overview of the program, and of course, is a kind of an entry point in trying to understand who we are, first of all, as a higher education institution, the programs that we deliver. So largely focused in the field of healthcare, so no longer just osteopathy, and the nature of this program. So I hope that you have enjoyed this presentation, you found it useful, and of course, any queries, you can get in touch with me, or of course you can get in touch with the team at Sutherland College. So I hope to see some of you soon in Schlagenbart during the first teaching block.